And welcome to officially the 988 Crisis Jam. My name is Megan Haupt. I'm Chief of Staff for the National Association of State Mental Health Program Directors. Really excited. We're on episode 219, and we are going to have a fireside chat regarding From Beyond Beds to 988 with Dr. Brian Hepburn, who is the Chief Executive for NASHPD, and just an incredible supervisor, mentor, leader nationally, just one of these people that lifts everybody else up in the process of collective movement. So Dr. Hepburn, thank you so much for being on today. Let's go to the next slide. Great. So just some housekeeping pieces. You can select speaker view rather than gallery view in the upper right corner. If you want to join in, and we encourage you to share your thoughts and questions in the chat. We remind you just to stay on mute unless you're a presenter, and also reply to any of the trivia questions that come up. We're excited about those always, but respond to in the poll rather than in the chat. So love that. Want to also remind folks about the new ASL feature. So this feature, it can be accessed at the very bottom under it's like a little globe that says interpretation. Okay, for some reason I was muted. So the ASL piece is under the interpretation globe or under the three dots where it says more, where you can access that ASL feature. Okay. And incredible. Over 219 episodes since 2020. There are 547 unique speakers. Wow, what a community. If you've got a hot topic, please let us know. We want to get the word out. We have 3 additional new speakers that we added just recently. We've got Drew and Annalise from Kansas from last week, and we have Rebecca Howard that's going to be speaking today as new speakers. So I'm excited about that. And we've got live streaming on YouTube. So this can be accessed on YouTube if there's an issue with the Zoom link, or you have a government Zoom that not compatible with registering for this. We always encourage people to register for the 988 Crisis Jam, but as an alternative, the Zoom live stream is available to you. All right. And so here's the talk.crisisnow.com to be able to register for the Crisis Jam. You get your own personal link. We encourage you just to keep that link with yourself. If you have friends that want to join, please give them this information. We love sharing this information. Videos and materials are available there too. As you can see, previous episode here with Monica Johnson. And so it is a great website, just full of resources, full of past episodes. Great. And so again, these are the past episodes that you can access on YouTube. So excited for that. And we have many debates coming up. And we want to have more of these debates. We have them sporadically, but we want to increase them. They really get the dialogue going and have people think about the issue from multiple perspectives. The next one is June 18th on crisis facilities should require parents to stay during a crisis episode. And we have Gwenda Summers taking the affirmative on that, and Dr. Vernon Barksdale taking the, I don't know if I want to call it negative, it's more like a different perspective. And that'll be episode 222. Right. And then July 16th, there's a debate on coordinating follow-up care and crisis services requires high-tech software solutions. Interesting. So David Covington, our great friend David Covington, is going to take the affirmative on that. And we are exploring who will take the different perspective on that. We'll call it the negative. Okay. Really excited that we'll have live and on location episodes. We have these every once in a while. The one that is coming up is in, look at this, love that camera, those graphics. So the one coming up on June 4th is in Columbus, Ohio. Just really excited for this facility. It is live and on location. If you were part of the Huntsman facility in Salt Lake City, and you saw that live and on location. This one is even more up close. Both are great. It's just lots of improvements and thoughts on how to make it even better. And that is June 4th. Note that this is a huge facility. And the neat thing about seeing Columbus versus Salt Lake, they each kind of complement each other's models. Columbus has 60 recliners, 16 inpatient. So really cool. Take a look at that. Episode 220. We have special guests. That'll be episode 220. The live and on location, Franklin County Crisis Care Center in Columbus, Ohio, and Erica Clark Jones and her team will be showing us this. Again, June 4th. Great. And also wanted to let you know about a webinar that is happening today. I don't know if it's an actual webinar, but it's an event. It's happening today. So we encourage you to register for this. It's called Collective Insight Dialogues, Safety, Strength, and Connection, the Role of Peer Support in Crisis, Disaster, and Trauma. So take a look at that. It's, I believe, happens at, let's see, I think 11, 12, 1, 2, about 2 o'clock Eastern time there. Yeah, via Zoom. Okay. And then this is an incredible piece of research that has just come out. It has just come out. The National Suicide Prevention Lifeline, now 90-day suicide and crisis lifeline. It's an evaluation of crisis call outcomes for suicidal callers. This is basically, does 988 work? And what I want you to see is one of these sentences, the vast majority, it's almost the second to the last sentence there, the vast majority of suicidal lifeline callers thought their crisis call helped them, nearly 98% of those, and stopped them from killing themselves, 88.1%. That is huge. And you'll see in the chat there that David Covington has put impact. Definitely. And so did want to highlight, we played this in the pre-show. We always encourage you to join the pre-show to get these special treats. That Sheryl Crow dropped a song called I Know to reflect her own struggles with mental health or whatever she's struggling with. And it's Mental Health Awareness Month. And so this is just such a special song. We'll be playing it at the very end, and we encourage you to stay on to hear that. Really beautiful. And this is interesting. So David Covington was talking about these items like, do you do New Year's resolutions? What would be good for your life? Making even resolutions along the way in your year, you know, to quit smoking or losing weight, or I like to stop replying LOL. I'll never stop that myself. But increase physical activity and exercise. But we are going to go check out what is the formula for fulfillment as our Crisis Jam showdown. And so as his final act as the 21st U.S. Surgeon General, Dr. Vivek Murthy offers his parting prescription for the well-being of the country. So this is a question for all of you. What are the 2 words Dr. Murthy used? So go ahead and answer what you think it is in this poll and submit your poll. And let's see how we all do. It seems like all of these are great things, right? Find your purpose, build belonging, choose community, create connection. but what are the two words Dr. Murthy actually used? All right. Let us know when we can check this out. And let's see who earns the Crisis Jam crown this week. Okay, we've got 54% create connection, 17% build belonging, 15% find purpose, and 15% choose community. Wow. So what is it? It is choose community. So Dr. Vivek Murthy said choose community. So great. Absolutely. And that's something you have to actually choose. It does create connection. It can build purpose. But choosing that community really emphasizes that. So, and he was on Meet the Press recently to talk about loneliness and connection. And let's take a look at a short clip of that.
Dug into the data, two things emerged. One is that loneliness is extraordinarily common. We've got over half of kids who are saying, for example, that they struggle with loneliness. And by the way, kids across the population struggle the most. But it's also consequential. So when you struggle with loneliness and isolation, it raises your risk of depression, anxiety, and suicide. But it also increases your risk of heart disease by 29%, stroke by 31%, dementia by 50%. Among older adults. And the overall mortality increase related to social disconnection is comparable to the mortality impact of smoking and obesity. That's how powerful and how important loneliness is.
Wow. That is very powerful, just what connection does for us. And that we're social creatures, Let's go to the next piece. This is also Dr. Julianne Holt-Lundstad. And she says, it's time to prioritize our relationships like our life depends on it, because it does.
Persistent loneliness is what has been shown to lead to some of these really incredible detrimental effects. Oftentimes we have these caricatures of what we think a lonely person looks like, right? And oftentimes these caricatures are the older adult or the teen sitting in their basement on their phone, right? But loneliness looks like you, it looks like me, it looks like all of us, right?
I love that. Loneliness, a biological signal, just like hunger. Wow. So we also want to just go to that Christina Huntsman and Tanja Miles were at an event last week, and Dr. Kleinschmidt was also there. Dr. Art Kleinschmidt, who's the new director of behavioral health on the federal level, and we'd like to just show this powerful event.
We have a unique opportunity to do amazing things. We all know that there's some uncertain times going on, and all of us are in a place of not knowing what's next. But the beauty of what's next is that we're going to continue to do this work.
We look at cancer. We have over 70 designated cancer centers around the country. Why don't we have even one for mental health? Where are we in mental health and substance use?
Lives depend on it. Moms need us. Those who are suffering with addiction and mental health, they need us. And so we're going to show up, and we're going to show out, and we're going to keep hope alive. Hey guys, what's good? So we're in DC today. We have had a phenomenal time doing this briefing, public safety, public health, public hope. When all these amazing people come together, that's when real change can take place.
It's so important that we can get all of our mental health leaders together and share what we're all doing. We've all been siloed for way too long.
What a great assembly of good people who are doing amazing work that is in this room. The briefing today was well attended. So many amazing people showed up. The panelists was great. It was really amazing, just the energy in the room, everybody on, with one mind and one mission.
The one thing I want to say about all of this, and the one thing that actually needs to come true in this, is the word hope. Hope is real, and hope is like how you kind of take one step and get to the next one.
With May being Mental Health Awareness Month, we took this time to talk about mental health, but also this is not something that's new to us. We're true to it because it's a conversation we have to have 365 days a year.
There's been a lot of organizations that have been in this space for years, and it's about time that we showcase and spotlight the work that they've been doing and push out the amazing work that's being done around the country.
I just want to say thank you to all of you guys who came up and showed out. I mean, you guys came from far in some of the most uncharted and some of the most uncertain times in our country and our community when it comes to mental health and substance abuse. But to know that you guys are still doing the work, you will continue to do the work because we know it's all about lives. We just wanted to take this time and honor you. Shout out to the Huntsman Family Foundation, to the Huntsman Mental Health Institute, and of course, Set Free Indeed. What a great partnership. It's going to take all of us working together. We want people to know that you are not the only one and that treatment and recovery is real.
Wow, that was inspiring, energetic. I love that. Love that video. Thank you so much for putting that together. Whoever did that, I mean, the sponsors did at the end there. There were many, but absolutely incredible video, incredible event. So thank you. We're now going to move to the Fireside Chat about From Beyond Beds to 988. And we are going to hand this over to David Covington to do this chat with Dr. Brian Hepburn. And Dr. Brian Hepburn is the Chief Executive for the National Association of State Mental Health Program Directors. And just an incredible national leader and did incredible work in Maryland as well as 10 years as medical director and 13 years as the behavioral health commissioner. So, and has had an incredible impact at NASMHPD and nationally. I'll hand this over to David Covington. Thank you.
Thanks so much, Megan. And Dr. Hepburn, thanks so much for joining us and being in the Fireside Chat seat. I want to start, and let's usually we kind of start at the beginning. I want to start at the end and go backwards. A couple of weeks ago now, we had this amazing debate with Hannah Wesolowski and Tom Betlock. And at the end of the day, the end result is 16 states materially funding 988, one of the most transformative movements of the behavioral health era. Pretty exciting stuff. Would love to start with your reflections on where we are, Brian, and that debate in particular and what that meant to you to see the movement. Lots of work to do, but it really shows how far we've come. Your thoughts, Brian?
Yeah, I think that you summed it up really well, David, that we've come a long ways, but when you look at it, we've got a lot further to go. And I thought that debate was very good, and two very good debaters bringing up good points and essentially agreeing with each other. And if I reflect back on Tom, one of the comments he made was regarding braided funding, looking at Medicaid, federal funding, state funding, local jurisdiction, et cetera, and even the private sector funding. And I think it's really important because many states are looking at how do they sustain funding for crisis services, for 988, for CCBHCs. The federal government has been such an important partner. And so in thinking about it, David, and in reflecting, I think that one of the successes that we've had, or an area of success, is the fact that we have what I would refer to as braided ideas, braided strategies that really the 988 Jam is a good example of, right? That you have ideas that are coming from the federal government, ideas that are coming from the states, from the local jurisdictions, from the multiple disciplines And what this learning collaborative does is take those ideas, spin them, let people who are in the audience take from the ideas that are being presented and use them to improve their systems. So as we're looking at sustainability and funding, I also look at what is it that we need in order to sustain the movement, sustain the ideas, use that creativity so that in the end we have success, which, what is the end? As you're pointing out, where is the end? Well, the end may be 20 years from now. If we look at what happened with 911 and how long 911 took, it could easily be another 20 years. So if people lose their energy, if we lose the funding at this point, we are only a fraction of the way that we need to be in order to be successful. And I look at this 988 jam as so important to make sure that we continue it, to make sure that we allow the ideas to come forward. And what you and your team have been so good at is bringing presenters from all across the country to help stimulate those ideas. And I like to think of them as braided ideas and braided strategies. So thank you.
I love that language, Brian. Braided ideas, braided strategies. It reminds me a lot of the innovation talk around cross-pollination. When you get different stakeholders from different geographies, from different lenses, providers, funders, family members, individuals themselves, it creates this rich thing. So the Crisis Jam community, it is, we've talked a lot about Richard McKeon originally starting this group in the spring of 2020, right at the heart of COVID. It really predates the 988 discussion when we were looking at the impact of COVID on things. But then we got going, and in the fall of 2000, we pivoted to 988 preparation and 988 community. And Brian, our partnership, you were the ones, again, I think gentle pressure relentlessly applied is my sort of way of thinking about how things really get done. Your tenacity with this. And Brian, you were the one who began to bring states to the table. You and I had conversations with Richard early on. I remember when we had, originally it was a group of a few people who were the usual folks in the crisis space, all from provider organizations. And then by fall, we began to say, let's bring states to the table, state leaders, state experts in crisis. And then we had 5 states and 10 states, and we hovered there for a while. And then you decided, let's make it nationwide. Talk us through how you did that, Brian, and how you are seeing this being such a priority for states, all 50 of them, the territories, et cetera.
Yeah, so I think it evolved, right? If we look back 8 years to the Beyond Beds and to the papers and the work that was being done, it seemed like the states, the timing was right. States were looking at how do we do more in terms of taking care of the continuum of care, making sure people get the services at the level that's needed rather than being pushed up to a level that they don't need, but a level that's available, often emergency rooms and inpatient, and unfortunately, sometimes jail. And that's something that all states seem to embrace. I would say all states and territories. So as we move forward to the crisis services and then 988, it all kind of fell in place. The federal government was working on it as a lot of the work was started during the previous Trump administration, continued during the Biden administration, and it's being continued again in the second Trump administration. It is truly bipartisan, is supported in all states. So one of the things that sometimes comes up, as you brought up earlier, is the fees. Well, we have states that embrace the fees, pass the fees because they value it. And there was bipartisan support. But there were some states that they would never embrace fees. They think of them as taxes. And what they did embrace, however, was the concept of 988 and crisis services. And so they basically used other ways of funding the needed work for 988 and crisis services. So I would say that when you're talking about my role or the role of NASHPD, a certain amount of it was pushing in a direction that everybody wanted to go in, right? And so that becomes easy. If you're trying to push against what people are wanting to do, you're not going to get a movement. What we found is that gentle pressure that you're talking about applied consistently was very timely, because that's what states really wanted to do. They wanted to have changes in their system and see more of the work being done in the community rather than in higher level services.
Brian, you used the word a movement, and the striking part of this, you're keying in on that there's a coalescing community around this, but there are also people who were on their own in a vacuum doing the same things because it makes sense. The pressure of hospitals, the pressure on our law enforcement, we don't want to engage with law enforcement unless we need to. All those sort of things are sort of natural. We'll visit Columbus next week, and they've been working on that facility as a community for 10 years. This is before we did Crisis Now. They're doing that on their own in their community. And then we come alongside and work together in this. Now, there's a question in the chat from Monica Luke. Hopefully the Crisis Jam is accelerating adoption compared to 911, because we didn't have the internet back then. Why is this so hard, Brian? So you said 16 states is a great a milestone and so much work to do. Why is it not faster?
Yeah, I mean, I think that when you look at it, it has moved pretty fast, and it may be like Monica said, that it's related to the internet, to the methods of communication that we have. But also, I would gently push back on that sometimes that also creates more distractions, and it's really harder to sustain a movement, because the audience, often when we're talking about the public, they get distracted onto something that may be newer and more exciting. So I think she's right that it has made it easier in some ways, but we have to keep applying the pressure and keep pushing forward, because the public will find distractions to take away the motivation and the movement.
I love you brought that up. There's so many shiny new things. When we come in as an administrator in a new role, we want to make our own mark. So heading a new direction, it's so hard to just stay focused. And Brian, I've had such a privilege in my career to be mentored by people like yourself, Richard McKeon, John Draper, Mike Hogan. But you and Richard have been driving this focus on crisis and helping us stay focused for how many Beyond Beds papers are there at this point, Brian? This has been going on since 2017, 2018?
Yeah. So Elizabeth will be on the call later. She can give you the exact number, but I think we're up to 70.
Wow. So Brian, I think one thing our audience will love to hear is your story of Beyond Beds starts from the very beginning. Were you 6 years old? And I didn't know you were an immigrant to this country. So share our audience of your arrival and your engagement with the mental health community from day one.
Yeah, so my family came over to the United States in 1957. I was 6 years old. And the person who sponsored us was an aunt who was a nurse. And she was a nurse in the local state hospital in Michigan, Pontiac State Hospital. And back then, many employees lived on the grounds of the state hospital. Well, her best friend was the charge nurse for the hospital, and she lived on the grounds. So we spent a lot of our holidays and birthdays on the grounds of the state hospital. And so it became a pretty, it was normal for us to go to the state hospital when a lot of other people looked on it with a lot of suspicion and concern. So later on, one of my first jobs was working in the state hospital. And unfortunately, also later on, when I was mid-teens, a family member developed a serious mental illness and was in and out of that state hospital for the probably 8 times over that next 10 years from 1965 to 1975, probably hospitalized between 7 and 8 times. And so all those experiences probably pushed me in the direction of going into psychiatry and trying to do something in mental health. So that the experience, though, that our loved one had was actually a positive experience. Yeah. If I go back to the time when it was John Kennedy had just come out with community psychiatry, community mental health clinics, short-term hospitalization. Well, my mom went into the new state hospital unit, averaged 30 days. She was in 30 days out in the community mental health clinic. And then she did go back and forth several times. But that state hospital really turned her around in terms of, or turned our family around, not just her, in terms of stabilizing her illness and helping us adjust and understand what was going on.
Wow. So, Brian, what has changed? You started in psychiatry early on in your career, but you were on a state hospital campus. And if I remember correctly, the patient's guests would be out into they had opportunities to walk the campus. So you were in and among those individuals, and you've seen these campuses up close and then worked in them and then tried to expand the scope of Beyond Beds. Talk about what are the most significant things you've seen change through that time.
Yeah, so the people that I met back in the 50s and 60s were dedicated nurses, dedicated staff. They really cared what they were doing. I would say, and looking back, there was a paternalism, though, that almost treating people in a childlike way, right, that they couldn't go back out into the community. There was a feeling of protecting individuals rather than giving individuals their independence to be able to go out and try to recover partly in the community and to be successful in the community. To where we are now, where there's a recognition that hospital care is an important part of the continuum of care, but that there's a lot more work that can be done in the community, and that community care is actually underutilized because of lack of availability. And as we look at what is going to benefit individuals, especially with serious mental illness, we want them to be in the community at the level that they need care, getting the care they need. And the way that we're successful is working with police, working with judges, getting everybody to understand that when you're talking about people with serious mental illness, it doesn't mean long-term hospitalization. Individuals can be returned to the community, be successful in the community. I said that in my family, it was my mother that had a serious mental illness. She returned to be a great mother and a great grandmother, and she was, I think if you talk to the grandkids today that she helped bring up, they would talk about her as a very loving individual who, by the way, also had a mental illness. And I think that's what we want, right? We want people to have the opportunity to be successful, and we want to make sure that services are all geared in that direction.
Yeah, great stuff. There's a note from Karis Myrick in here, benevolent protection, quote unquote. Yes. And she says, in some ways that still happens both in hospital and community settings, especially for people living with diagnosis of schizophrenia. What are your thoughts, Brian, again, about the movement we've made around recovery and peer engagement and the work we have to do?
Yeah, so I think the big difference, there are many differences, but I would say that the big difference is in peers. Having peer availability. When I first started, it was us and them, right? The healthy and the non-healthy. Well, it doesn't take long to realize that's pretty artificial, right? And so over the last 30 to 40 years, that increased recognition that people with lived experience, people with peers, have a lot to do with helping others in their recovery. So I would say that that's been one of the big changes in the recognition that peers can have a leadership role as well, not a limited role. They can have a leadership role in making the lives better for people who have serious mental illness. So that the whole movement together with the continuum of care in the community, more peer involvement, getting police involved, but getting police involved in a particular role, not in a role that they were unprepared for. Getting judges the same way, to be able to work in a role that they're prepared for. Often we're asking judges to make decisions about people with serious mental illness that they're unprepared for. So they often make a decision that is wrong, referring for competency, et cetera. So I think that we have good information out there. This learning community, this learning collaborative is so helpful. It's a way to bring in law enforcement, bring in judges, bring in legislators that can learn from people with lived experience, from people who have seen success, and so that they feel more hopeful. I think that you showed a video of Art Kleinschmidt, and he was talking about hope. Take one step to get to the next step. And I think that that's what we are trying to do, is to really maintain that feeling of hope, helping people to go beyond feeling stuck in their illness and helping them to move beyond their illness and into feeling like they can recover. So,
Brian, this has been terrific. I'm over time, but I'm going to take the liberty of one more last question. We've got several comments in the chat, which I think all warrant featured presentations in the future. We've not done enough. Eduardo Vega on seclusion restraints, John Draper on the pressure for states to fund more state hospital beds. There's a lot of good stuff in here that we'll come back to. But NASMHPD supports the mental health state commissioners, and you were a state commissioner when I met you in Maryland. What's your main advice to the young commissioner coming in right now, especially in this new era of 988, Brian?
Yeah, I would say the biggest thing is to, there are several things. One is, don't feel like you have to do everything yourself. There are a lot of people with, a lot of subject matter experts out there. Lean in, listen to the experts. No criticism to people that are feeling like they don't know all the answers, right? Nobody knows all the answers, but I think sometimes when you come into a role like that, you feel like you have to be ready to make decisions and make the right decisions all the time. So,
Brian, thanks so much for your leadership, your support. We're in a completely different place. And yes, appreciate we've got work to do, but we're on a path to do what 911 has done, and that's transform the response for people in pain. And your leadership is guiding us there. So thank you so much. Megan, what a joy it's been, Megan.
It has been. And I do want to say, you know, working at NASMHPD and working on this issue has been absolutely phenomenal, with Brian Hepburn's leadership and, you know, a community. I do want to bring on Elizabeth Sinclair Hank first, and get her take. Elizabeth is Senior Research Advisor at NASMHPD. She writes so many of the papers that Dr. Hepburn was referring to, and along with Dr. Deb Peinel. So Elizabeth, if you could come up and share your perspective.
Yes, thank you, Megan and David and Dr. Hepburn, for inviting me to speak today and reflect on this really interesting and important chat on how the behavioral health field has moved beyond beds to this more community-first approach to care. And to answer your question, David, Brian was correct, 70 published Beyond Beds papers as of now, with 20 currently in the works for fiscal year 2024 and 2025. So hopefully we'll have some more to share with you all soon. As a health services researcher and policy person, it can be so easy to think about services and systems and legislation and policies, but it's really important to remember that these are all about people's experiences and the treatment and the care that's received in those services and systems. So I really appreciated those aspects of the conversation today. So as Brian mentioned, NASHPD's foundational report, Beyond Beds, the Vital Role of the Full Continuum of Psychiatric Care, was first published in 2017, almost 9 years ago now. And the report and the subsequent strategies and directions that have followed really highlighted the efforts to move beyond this inpatient institutionalized care as the sort of single solution that states and other policymakers were using as calls for reform for individuals with serious mental illness. And I think the transition to 988 in 2022 has really been a catalytic shift towards advancing these efforts with some of the most expansive funding and legislative strategies in more recent years. And so I thought it'd be useful to go back to some of the original 10 recommendations from the 2017 report that are maybe especially meaningful and relevant to our conversation today, and then highlight some that might need some more progress is needed. And so the first two recommendations in that 2017 report were about the vital continuum and standardization of terminology. And I think huge progress has been made in those, especially with SAMHSA's leadership in the recent publications of the model crisis definitions and guidelines, as well as the data-driven solutions and increasing utilization of technology for appropriate information sharing, especially related to 988 and 911 collaboration and coordination efforts. One of the recommendations that perhaps might need more progress is needed. While there's been many efforts and initiatives underway, workforce issues sort of remain and is one of the top issue we hear at NASHPD continually hear from state leaders as a topic needing attention. In terms of what's next, since 2017, we've been publishing these Beyond Beds papers annually every year. And the upcoming series, Advancing Crisis Care and Beyond, in the umbrella paper, Dr. Peinels and I revisit the Beyond Beds theme and provide some practical steps for states to take to further advancements in crisis care, as well as the whole system. Included in this series are papers related to the youth crisis continuum, as well as one focused on medical and pharmacy resources, written by Dr. Browning, who's often featured on this Crisis Jam, that I think are especially relevant to the Crisis Jam, and we hopefully can't wait to share them with you all soon. I really love David's comment about the gentle pressure relentlessly applied, and then Brian's follow-up about the importance of pushing with the movement versus against it. And I really think that's exactly how these paper series have had the success and the impact that they have. So special thank you to SAMHSA for the support of these policy papers over the years, as they really do help shape the narrative and moving us all forward. And that's it. Thanks. Thanks, Megan.
Elizabeth, incredible. And thank you for your awesome work on these papers, along with Dr. Peinels. One thing I really want to underscore from all of this is the leadership. Elizabeth mentioned workforce. Dr. Hepburn noted how important it is for leaders to not feel like they have to do this all by themselves, that they're subject matter experts, that even with peers, that old paradigm that there was an us versus them, or a healthy versus unhealthy, and that split, we're really, throughout this entire Crisis Jam, we've been talking about, Dr. Vivek Murthy saying, choose community, or the musical icons sharing their own struggles, that we're all human here, that we can't do it by ourselves, and how important it is to have a community like this learning community of the Crisis Jam to help move things forward and share ideas. And what a hub to have law enforcement or legislatures or providers, peers, all be in one place once a week to share best practices, innovations. It's a really powerful community here, a learning community. And so, utilize that and keep it going. We have incredible momentum. While we have a long way to go, I think this momentum is really like no other. This paradigm shift of diverting from jails, diverting from emergency rooms, diverting from higher levels of care that are unnecessary in many circumstances, but necessary in some, but not all. So just really appreciate the thoughts and the journey of how we got here. So thank you. All right. So let's move to Wendy Morris from NASMHPD to give the NASMHPD update. Go ahead, Wendy.
Thank you, Megan. Great to be here with everybody today. That was a great fireside chat, and I loved the roundtable. So I'm just going to share a few reflections from my time as commissioner in Kentucky in implementing 988. We were in a pretty good position in Kentucky when 988 was implemented. We had Lifeline call centers active in our communities, and all 14 of our community mental health centers had at least some crisis services. Some had ACT teams, some had crisis stabilization units. One reason we were a little ahead of the curve was because we had entered into a settlement agreement with Kentucky's Protection and Advocacy Office in 2013 in an effort to get folks moved out of the hospital by developing the needed community services. But still, like was just emphasized, it's been a slow process, and that work continues. There were lots of barriers to overcome. Workforce shortages certainly was one and continues to be one, especially in the very rural parts of our state. Medicaid reimbursement rates is another thing we struggle with or have. And then getting consensus between all partners. There's lots of partners, and getting everybody kind of on the same page is always a struggle. We've been fortunate here in Kentucky to have some really strong leadership over the years for that 988 implementation and oversight, not just at the Department of Behavioral Health, but also out in our community mental health centers. One thing that I do wish we'd had when I was commissioner, we can go to the next slide, was access to the resources that you can now get at the Link Center. And I've talked about the Link Center a couple times on here, but it's a project of national significance to improve the services and supports for people who have co-occurring mental illness and intellectual developmental disabilities, brain injury, or other cognitive disabilities or communication differences. And there's all kinds of resources on here. There's some general education aimed at people with lived experience, family, right, to professionals or direct support workers. So there's something for everybody. There's information on there, tips for communication. There are ways to adapt certain evidence-based practices like ACT teams. We did have last year a 988 Policy Academy for 6 states, and some of the lessons that we learned is that really the importance of cross-agency collaboration, which we're just kind of that braided strategies, bringing everybody to the table and looking for consensus and how to move forward. We learned that myths and misperceptions about people with disabilities still exist, right? People with disabilities do have mental illness. They can benefit from treatment, and evidence-based practice can be adapted. We know that learn that call center staff and first responders need ongoing support and coaching to support individuals who may not use the spoken word to communicate. Lots of work to do there. And that what happens after the call is really important, that it's important to have services that are going to meet the needs of people with disabilities, and we need to figure out how to overcome exclusions related to folks with intellectual and developmental disabilities. So if you haven't checked out the Link Center, please do. Lots of great stuff in there. And that's it. Thank you.
Wendy, thank you so much and for your incredible work. All in all, on all of this. Wendy has been a great leader at NASMHPD and beyond related to this issue. So thank you. I'm going to turn it over to Sarah Corcoran from Guide Consulting.
Thanks so much, Megan. We can move to the next slide. All right, I will start out here by noting that we are on a recess week for Memorial Day week. Memorial Day week is a recess. The House and Senate will be returning next week into DC. Onto appropriations, HHS Secretary Kennedy has begun making the rounds of relevant health and appropriations committees in the House and Senate this month in defense of their HHS FY26 budget request. We've still not seen the full request document, but we've gotten an idea of their overall requests, more streamlined version that came out late last month. He appeared before the House Appropriations Committee as well as the Senate Help Committee in the week of May 14th. And last week he appeared before the Senate Appropriations Committee. The process has begun moving along, as you can see in the House and Senate, and we have gotten indication of the schedule for markups for the FY26 Labor, Health and Human Services bill. In the House side, we have not gotten indication of when that would happen in the Senate side. On the House side, it will be the 21st of July for the subcommittee markup, and then the 24th of July for the full committee markup. I will drop into the chat a link on that schedule so people can get that relevant information and tune in if it is of interest. I will now turn it to Emily from AFSP for the second half of the federal update.
Great, thank you, Sarah. So we've talked a little bit about reconciliation on the last couple of jams, and we do have an update to share. So on May 22nd, the House of Representatives passed a budget reconciliation bill. It did include significant changes to the Medicaid program that I know we had flagged previously might be in there, as well as the Affordable Care Act, Medicare, and health savings accounts. Many of us I know have been tracking this process closely. In particular, changes to Medicaid, as Medicaid funds a quarter of all mental health services and nearly 40% of all substance use treatment. So the House's One Big Beautiful Bill Act, which is what the bill is called, it's HR 1. It makes those deep cuts to Medicaid that we were monitoring might be included. It did pass the House by a vote of 215 to 214. And specific provisions include Medicaid work and verification requirements, suspensions of rules to streamline Medicaid eligibility, as well as reductions to federal funding to states that use their own funds to cover undocumented immigrants. So next up, the bill will move to the Senate, where there may be substantial changes to the House passed measure, and we'll be monitoring that and sharing out any updates. So more to come in the next few weeks. And then finally, we did want to share one more update. On May 20th, Representatives Don Beyer of Virginia and Brian Fitzpatrick of Pennsylvania reintroduced the Bipartisan Barriers to Suicide Act, which is HR 3505. In 2023, more than 49,300 lives were lost to suicide, including 1,297 deaths by falling. And research shows that these deaths are preventable by reducing access to lethal means. So this bill would create grants to help state and local governments fund barriers and other structures that have been shown to reduce suicide on bridges and other high-risk infrastructure. I know AFSP and other groups are looking forward to supporting the bill this Congress and working with the sponsors and other partners to advance it. And we'll keep you all updated on any future efforts there. And with that, I will turn it back. Thanks.
Emily, Sarah, thank you very, very much. We are going to turn this to Stephanie Hepburn to talk to Rebecca Howard. Stephanie, go ahead.
Thanks, Megan. Yeah, so I'd like to welcome Rebecca Howard. She's the program director at Samaritan South Coast in Massachusetts. Rebecca, the song you wrote with your son started as conversations with them about suicide. Can you share where the dialogue began and what the impetus was?
Yeah, my 13-year-old son recently had a friend that committed suicide in the last month. And I really wanted to talk to him about the impact and the support that's available not only from home, but with a lifeline because sometimes they're not comfortable talking to mom. So I wanted to make sure that they knew that that support was there and they can also talk to their friends about it. So it's just really creating the conversation around 988 and that it's only 3 numbers away and they can be anonymous, and it just kind of built from there.
So you've been playing around with some music software, making like silly songs to bond with your kids. You mentioned one for your daughter was, toothless, being toothless with your best friend. And so like what was the tipping point? When did talking about this, when did you start writing it down and you all decide, hey, this is something we want to turn into a song?
I think it was when we were kind of sitting there, we ran out of ideas and we've been talking about 988 and just 3 numbers away. And I was like, that kind of rhymes. Maybe we should try to build on that and kind of talking about the resources and what we do as a crisis center here for Samaritan South Coast, providing resources and just a listening ear and just trying to help create safety plans and hope for that person, and that we can do that as a resource. So it kind of built again on top of it because it felt like it kind of wrote itself as we discussed more of what we have available. We started adding it into the lyrics and started kind of playing with the music and how we wanted it to sound. And then I shared it with my team, and they were really pushing for me to share it beyond just internally with our group.
You shared that 2 of your sons, the 11-year-old and 13-year-old, participated in putting the music video together, which was really cute. Then you also mentioned that they were a little bit sick of the song at this point, but that they've enjoyed it being on YouTube and reading the comments. And we are so excited. Also, we're going to share it at the end of the program so everyone can hear. Do you have anything? One thing I thought was really great that you mentioned was wanting to empower your boys to talk about it, not just amongst themselves, but with their friends.
Yeah. For myself, being new in the mental health field, only a couple years with our team, I learned so much. And I feel like knowledge is power. And I really wanted my boys to not only be comfortable about talking about suicide within our home, but having that conversation with their friends. They may not have a home that's comfortable or knowledgeable about the resources that are available out there. So I really wanted them to have that voice, to not be afraid to say, I see you struggling, and did you know this is available?
I love that. Thank you so much for hopping on with us. And we'll share the song at the end.
Thank you so much.
Thank you so much, Stephanie. Beautiful interview, and hopefully we can maybe drop a link in the chat to the song because it's a beautiful song. So going to episode 220 for coming next week, live and on location, Franklin County Crisis Care Center, Columbus, Ohio, and Erica Clark-Jones and her team will be showing us around live streaming. So it's going to be excellent. Just really looking forward to that and seeing all the special features of that center. And then after that, coming in 2 weeks, episode 221, A Day in the Life of Crisis Care, Part 2, Someone to Respond. So Part 1 was the call center experience, and then Part 2, Elizabeth Jimenez and Megan Gleason. I have to use my readers. I have those transition glasses that cause problems. But anyway, all right. Thank you, everybody. Thank you so much for watching.